Okay, let's get started. Welcome to Ozarks Community Hospital. We're going to be talking about basics of hepatitis this morning. What we're going to learn here is some basic information about hepatitis. That kind of explains why we're here. The class is all about multiple different types of hepatitis, but we're going to have a primary focus on hepatitis C. Most of the folks in the class typically will be going down to see Dr. Bean. And this is just kind of a informational session that we like to do before folks go in for their first visit. So here we go. First of all, we're going to be talking about what is hepatitis? Is there more than one kind? How do you get hepatitis? Prevention of hepatitis C? What are some of the most common symptoms? What types of treatments are available, and what are the side effects that may occur with treatment. First of all, let's talk about what is hepatitis. Hepatitis can be broken down into two pieces, the word itself. Hepat means liver, and itis means inflammation. Of course, you put those two together, you've got inflammation of the liver, and that kind of gives a real basic definition of hepatitis. Viral hepatitis means there's a specific virus that is causing your liver to inflame. That makes it either swell or become larger than normal, and it can be very painful. That's a picture of the normal liver on the left at the bottom of the slide, and that's one later in stages of hepatitis with the scarring. We'll talk about some of the basic functions of the liver. It cleans the blood, it regulates hormones, helps with blood clotting, produces bile, it produces important proteins, it maintains blood sugar levels, and multiple other functions as well. It's located in the upper right quadrant of the abdomen. You'll see a picture of that right there with the arrow pointing to it. When you have hepatitis, many times the liver will swell and become quite a lot larger, and you'll actually be able to feel it down under the rib cage on the right hand side. And of course you have to have a liver. It is essential for life. The liver is basically a chemical factory. It's the largest internal organ. It's about the size of a football. Approximately, it weighs about 3 pounds in the average sized adult male, and about 1.5 quarts of blood flow through it every minute. One of the things that it does is cleans the blood as it goes through, and we'll see later some of the side effects and some of the symptoms you may see if it's not doing its job properly. Okay, again, that's just a picture of the later stages of hepatitis with the walls of scar tissue beginning to form. The healthy cells become trapped by a wall of scar tissue. You want to try to keep the liver healthy. Some of the things that you may do to be able to do that is to get vaccinated for hepatitis A and hepatitis B. Those vaccines are available. You also want to get the pneumonia vaccine as well. Up to about 30% mortality with a second virus. What that means is if you have both hepatitis B and hepatitis C, you may have up to 30% mortality or chance of death with both viruses present. Hepatitis C and B at least will also reduce survival by more than 20 years. Okay, we're going to list some of the important things to know whenever you go to your doctor for the first appointment. Those will include: when was it diagnosed? How old are you now? Did you have a blood transfusion before July of 1992? Clotting factors before inactivation in 1987? A parent with hepatitis C? When and where did you get your first tattoo? And have you been diagnosed with depression in the past? And we'll talk about the reasons that those things are important to know when you go in to see the doctor for your first visit. First of all, let's talk about, is there more than one kind of hepatitis? And the answer is yes. There's actually 5 types: A, B, C, D, and E. We'll talk a little bit about each of these, but our primary focus today is going to be hepatitis C. Both A and B, hepatitis A and B, are vaccine preventable. And again, it's a very good idea if you have not received the hepatitis A and B vaccine to go ahead and get that if possible. The hepatitis A is a 2-shot series. You get one now and then one in 6 months. And the hepatitis B series is a 3-shot series. Hepatitis A, there is a vaccine available. It's been available since 1995, and it does take 2 doses. One now, and then you get one in 6 months. Approximately 33% of folks have been infected with hepatitis A and may not even have known that. It resolves on its own, is not a chronic condition. The transmission route is fecal-oral. What I mean by that, let me just give you an example. Let's say that you go to a restaurant and you have a person that is a worker there who goes to the bathroom, fails to wash his hands. He comes back, he's touching the food goes to you eat it, you get sick. Another example would be someone that's also at the same place that you're in eating. They go to the bathroom, they wash their hand, they don't wash their hands, they come out and they're reaching down and taking a spoon in the buffet or whatever, and you're behind them. You touch the same thing, and then you've got it on your hands, and that's how exposure occurs. So, hepatitis A, there was a recent outbreak in May of 2014 in Springfield from a restaurant worker, resulting in over about 2,500 hepatitis vaccine administrations. The folks were allowed to go in and get hepatitis A vaccine that had been going to that restaurant after this was made public. Okay, the way to help prevent hepatitis A, of course, is to wash your hands. Just be sure that you wash your hands to keep from spreading hepatitis A. Okay, now we're going to talk about hepatitis B. Hepatitis B prevention. Of course, again, the first thing would be to get vaccinated. Do not share needles or works. During this time period, I'm going to be talking about some very personal issues with folks, and so just be forewarned that some of the things you may think, well, what does that have to do with me? And maybe it has absolutely nothing to do with you, but a lot of times we'll have other folks in the same class that they understand exactly what we're referring to, and this particular piece may be information that they'll be able to understand that gives them help understanding how they may have contacted hepatitis B or C. So, that being said, we'll move forward with the rest of the information. Hepatitis B prevention. Again, safe sex is definitely a necessity with hepatitis B because it is transmitted by blood and by sexual contact. Standard safety precautions, that would refer to if wearing gloves. If you are caring for someone else who has hepatitis B, you want to be sure that you're taking appropriate precautions to protect yourself. Do not share personal items. What I'm talking about here would be an example, using a razor. For example, if you shave and you accidentally cut yourself and the next person comes along, they shave with the same razor and they cut themselves, there you have blood-to-blood transmission. Same type of thing with toothbrush. You're brushing your teeth real hard and you got a little blood on the toothbrush. Next person, if they use that, they could be exposed the same way. There's also the possibility that folks could have been infected, mother to child, at birth as well with hepatitis B. Okay. Hepatitis B transmission. How it's transmitted. It is bloodborne. It can live outside the body for at least 7 days. It is highly infectious in semen and vaginal secretions, and that accounts for the majority of the United States infections of hepatitis B. It is commonly transmitted by sharing needles to inject drugs. It also has been transmitted by needle sticks and blood exposure accidents, sharing of personal items, and of course mother-to-child transmission. Okay, what is hepatitis C? It was identified in 1989 and screening started in 1992. That's why the earlier slide had mentioned that if you had a blood transfusion before 1992, that it was important to be able to remember that and mention it to your doctor, because that was a potential transmission of hepatitis C, because it was not screened for until July of 1992. There is no vaccine currently available. Many folks do not have symptoms of liver disease at all. A lot of people that have came through the class have had a hepatitis C screening or a hepatitis screening panel, and that's how they have discovered, their provider has discovered that they have hepatitis, not because of any symptoms, but because of doing the hepatitis screening panel. So it can sit dormant in your system for up to 40 years. We'll talk a little bit about hepatitis C statistics. In the United States population, more than 4 million Americans are chronically infected. Hepatitis C transmission and prevention. Hepatitis C is spread by blood-to-blood contact, so it is not spread by casual contact. Hepatitis C is the most common blood-borne pathogen in the United States, even more common than hepatitis B or HIV. Alright, we'll talk about hepatitis C genotypes and quasi-species. There are actually 7 major genotypes plus subtypes. Genotypes are numbered 1 through 7, and the quasi-species, which is quasi-species number 7, was discovered in 2013, which mutates quickly. In this area, typically what you will see is genotypes 1, 2, and 3. Those are the most common. If you have not had a genotype test, that is something that they will be doing, I'm sure, in the near future. In the United States population, typically you will see about 70% of folks with genotype 1. The other 30% is pretty much genotypes 2 and 3. Why is a genotype test important? It helps to guide treatment. It tells what drugs and treatment duration may be necessary for your specific type of hepatitis. Alright, genotype 1. Cure rates are up to about 90%. Some of the most recent studies have even been showing 97 to 100% success rate. Traditional treatment duration was up to 48 weeks, so almost a whole year of treatment. Current treatment duration in many cases has been reduced to 12 weeks and even 8 weeks in some cases. Dr. Bean will be able to discuss that with you, the treatment duration and specifics, on your first visit. How do you get hepatitis C? Can you get it again? The following slides will give details about how people contact hepatitis C and some ways to avoid exposure. And yes, unfortunately, you can get it again after it's cured. That's why that you must make sure that you're not exposed to the virus again. That's why we'll talk about some of the things that you may want to be sure to avoid so that you don't take the risk of being exposed to hepatitis again. Okay. Routes of transmission of hepatitis C would include shared needles, all drug paraphernalia, blood before 1992, sexual transmission. Healthcare workers may be exposed to hepatitis C by needle sticks, shared household items including razors and toothbrushes, tattoos and piercings, mother-to-child transmission, and just under 10% of routes may not ever be identified. When I refer to all drug paraphernalia, I'll get into some more details later, but that would include anything that you would use to cook or inject or snort any types of drugs. Alright, let's talk about transmission prevention. It does have to be a direct blood-to-blood transmission route for hepatitis C. It can live on surfaces for up to 6 weeks, so it's a very strong virus. But it also can be killed by bleach and other disinfectants, but probably not inside the needle. So what I'm talking about there is if you are sharing needles, even if you're using a bleach water solution to be able to clean out the syringe between injections, it may not get all of the virus inside the needle itself. It is not spread casually and does need to have blood for transmission. Alright, this is according to the CDC. What was reported to them, sources of infection for persons with hepatitis C, 60% of the folks reported using and injecting drugs. 15% was sexual transmission. Transfusion was about 10% before the screening process. And then other or unknown account for about the other 15%. Risk factors identified would include IV drug use and snorting, hepatitis C infected household member or sexual partner, tattoos and piercings, hospitalization, dental work, transfusion or dialysis, incarceration, and about 23% may not be able to identify the risk factor that led to the hepatitis C exposure. Okay, again, hepatitis C lives on surfaces for up to 6 weeks. It can be in syringes for up to 63 days. Commercially available disinfectants do kill hepatitis C. What they found whenever reviewing collected swabs, shared swabs, 83% of folks that were using IV drugs and were using shared swabs tested positive for hepatitis C. Hepatitis C was also detected in used water for greater than 3 weeks. What I'm talking about there in that specific instance is water used for cooking with the various drug products. It's also been found in bottles, and hepatitis C RNA detected even after rinsing out, and aluminum retained hepatitis C RNA even longer than plastic. It was found to be in 10% of filters wrapped in foil with other types of drugs as well for up to 24 to 48 hours. Prevention tips. We'll talk a little bit about tattoos and piercings. One of the things that is most important now is that the folks are using separate ink pots, not just disposable sterilized needles. But what in the past, some of the places were not using individual needles for people when they were coming in to have their tattoos done, and that's how exposure was occurring. But even after they have started using sterilized needles and disposable needles for each person, you need to be sure that they are using separate ink pots. And the reason for that is because if they have a person that comes in before you and they're hepatitis C or hepatitis B positive and their needle has been dipped into that same ink pot, whenever you have a sterile needle, the first time it goes into that same ink, you're taking the risk of being exposed with that as well. So that's very important. Some tattoos and piercings would be considered a higher risk in other settings. An example of that would be having a tattoo in prison, parties, on the streets. One thing that you want to be sure that you don't do is don't touch dirty needles without proper equipment or following proper procedures. So don't take the risk of sticking yourself with needles without wearing gloves and using the proper procedures. Okay, injection and non-injection drugs. Do not share needles, cookers, cottons, straws, pipes, water, or any items that may come into contact with the blood. I've had several people ask, what do you mean by straws? I'm talking about folks that are snorting. You may have microscopic small amounts of blood on the straw. It has a tendency to do damage to the nasal passages when somebody snorts and then they hand off that straw to the next person. There may be blood, you may just not be able to see it, so that's how that you could be exposed. Again, with people who do IV drugs, please use bleach to clean if there's no needle exchange available. It's not 100% effective, but it's better than using a dirty needle. Alright, prevention tips include also safer sex for the so-called high-risk groups. That would include folks with multiple sexual partners, people with sexually transmitted diseases, infection with HIV or hepatitis B. So any situation where there's blood or potential of blood being present, it's definitely recommended to use a condom using safer sex. Alright, what are some of the common symptoms of hepatitis C? Fatigue, mild to severe, flu-like symptoms, muscle and joint pain, fever. Brain fog, that one I hear almost every class. We've got folks that are saying, I just cannot seem to get it. I'm not clicking, I'm not able to focus. That's just a common symptom that you will see with hepatitis C. Liver pain. If you've ever had liver pain, you will definitely remember it. It is unpleasant, and as I mentioned earlier, you may actually be able to feel your liver just under the rib cage on the right hand side, and sometimes when you push on that, it hurts. You may have loss of appetite, may not want to eat large amounts of food at one time. It may be better to eat small, frequent meals. We'll talk more about that in just a bit. Headaches, stomach problems. This is a common symptom that you may see, or a sign that you may see. It's called jaundice. It's a yellowing or kind of an orangish appearing in the white of the eye. You also may see folks that are having pale stool as a symptom as well. Okay, about 10 to 25% of hepatitis C positive people progress onto serious disease, usually over about a 10 to 40 year period. You may start off with fibrosis, which is typically kind of a light scarring, moving on to cirrhosis, which there's basically a compensated and decompensated cirrhosis. Compensated, your liver is still functioning properly. Decompensated is where it is no longer functioning properly. Okay, with chronic hepatitis, about 20 to 30% of people move on to having cirrhosis, and then 1 to 4% with liver cancer per year. Most symptoms begin only to show when the liver is more severely damaged. We'll talk about some lifestyle changes that help. You want to definitely avoid or reduce your alcohol consumption. You'll see that slide come up over and over. Get vaccinated for hepatitis A and hepatitis B if you haven't already been. Try to eat a healthy, balanced diet. Again, one of the things you want to remember is try to eat smaller portions more frequently. That may help with the nausea. Exercise in moderation. Stress reduction is important. There are support groups available, and the nursing staff in Dr. Bean's office will be able to direct you to some support groups. You want to try to keep the liver healthy. Again, the things that you're wanting to do to assist with that is to avoid alcohol. Avoid mixing drugs. That would include prescription, over-the-counter drugs, herb supplements, and street drugs. Be sure that your provider is aware of what medications and what types of herbs and supplements you take. Sometimes what happens is we'll have medications that don't mix well with others, and it may actually reduce the effectiveness of some of the prescription medications. These folks were told to only have 2 drinks, so they decided to have 2 really big ones. What type of treatments are available? Treatment options will be discussed in detail at your first appointment. There are multiple different treatment combinations of drugs may be used. It depends a lot on the genotype of hepatitis C that's been diagnosed. One of the reasons that I don't go too much into specifics on that is because the treatment combinations of drugs will be discussed with you by Dr. Bean based on your genotype and information on how far along you may be in your disease process. Liver biopsy. It's the gold standard for determining the health of the liver. It measures inflammation and the extent of any scarring, and it helps to rule out other diseases. It's done by doing a biopsy procedure. Not everybody has to have a liver biopsy, but it is, like I said, the gold standard. There are some other non-invasive markers of liver inflammation, but they are not as specific and not yet perfected. Viral load test. Why is a viral load test important? It will help to confirm an active infection. It somewhat helps to predict treatment response, and it's used to guide treatment duration. It's an indication also that treatment's working. I'll just use some random numbers. This is not what you're really going to see on a viral load, but I'm just going to use this as an example. We'll say that your first viral load shows a viral load of 100. Again, these numbers are not what you're going to really see. Just an example. If your first viral load shows 100 and then 4 weeks later they do another viral load test and it shows 75. 4 weeks later they do another one, it shows 50. And then they do another one, it shows 25. What that is doing is just showing that the viral load is decreasing, that the medication is effective. Okay, moving on. What are some of the common side effects of treatment? It may be difficult to determine if some of the side effects are actually from the disease or from the medication because they can be very similar. Side effects of treatment may include fatigue, anemia, muscle and joint pain, nausea, headaches, anxiety, depression, dry skin, rashes, anal itching, photosensitivity, and multiple others. As you can see, a lot of those side effects from the medications are also common symptoms of hepatitis C. One of the things that you will note up there is depression. That's why that one of the first slides that you saw, things that are important to mention to your provider whenever you first go in for an appointment. Depression is one of those things that they need to know. One of the reasons why is because that is a common side effect of some of the medications that are commonly used to treat hepatitis C. So if you have a history of depression and you're taking antidepressants or you've taken them in the past, it's important to tell your provider that you have had a history of depression, so they'll be able to watch for that and make sure that you get the medications that you need to help you. The majority of the side effects that you see from hepatitis C treatment are from interferon and ribavirin. Some of the most common treatments now may or may not include interferon and ribavirin, but we will talk a little bit about the side effects just so you're aware in case that is one of the medications that you are prescribed. Ribavirin can cause birth defects. Women that are of childbearing age that are taking ribavirin want to make sure that they are practicing 2 forms of effective contraception during treatment and 6 months after treatment. You want to be sure that you do not get pregnant during that time frame. For men that are taking ribavirin, they want to make sure that they are using 2 forms of contraception as well during treatment and 6 months post-treatment. Do not want to take a chance of their partner becoming pregnant during that time frame. There have been a lot of medication advances recently, and within the last year or two, multiple different medications have been approved and are available for treatment of hepatitis C. Vicuri and Harmony are 2 of those medications that have been recently approved. Some treatments are no longer require injections and can actually be as short as 8 weeks with oral medications only. That's something that, again, you'll be talking in detail with Dr. Bean about. Okay, we're going to talk about managing side effects from the medications. Staying hydrated is important, so drinking lots of water is a good idea to stay hydrated. It is okay to take low doses of ibuprofen or acetaminophen. Be sure and talk with Dr. Bean about this, but my understanding is that low doses, we're talking just normal doses of ibuprofen or acetaminophen, are no more hard on the liver than other medications, and that is okay. Be sure and talk with your doctor. Light exercise is tolerated. Daily moisturizing, that's for that dry skin that is a side effect. Antidepressants as necessary. Plenty of rest. And frequent small meals. That may help with the nausea. Lifestyle changes that help. Again, avoiding alcohol. Reduce alcohol. Get vaccinated with hepatitis A and B vaccine. Try to eat a healthy, balanced diet, smaller meals more frequently. Exercise in moderation. Stress reduction. Support groups are available. Patient assistance programs. There are patient assistance programs available, and the staff in Dr. Bean's office are really good at helping folks with prescription assistance. They'll be able to direct you to where you need to go to be able to get help with paying for those medications. It's important to advocate for yourself, to educate yourself on the disease process and the treatment options. Establish a good relationship with your doctor. Those of you who have not met Dr. Bean, I think you may be surprised. He is not the typical 15 seconds in the door, "Hi, how you doing? Here's your prescription, see you later, bye." He'll come in and sit down with you and talk to you, explain things so that you'll understand it. He'll go through details of the treatment plan with you, and it'll take up to about 45 minutes on your first visit, so be prepared to take notes. You might want to bring along someone with you that will be able to also be a second set of ears, and a lot of times there's so much information that's given that folks have difficulty remembering all of it. So again, that's another good reason to bring an advocate for doctor's visits. Please feel free to ask questions. Typically what I've seen is a lot of people will have the same question that you have, and sometimes they're just afraid to ask. If you don't ask the question, you're not going to get an answer. So feel free to ask questions. Keep copies of your medical tests. Keep a diary. Sometimes that's very helpful. Some people like to do that. Some people do not. It's okay, whichever way you want to go with it. But I think that it can be really helpful, because what happens is you can look at this and say if you're going through a 12-week treatment process, you can look back, you can see the copies of your medical test, you can see that your treatment is working, and even if you're having some significant side effects and it's not very pleasant, you have a light at the end of the tunnel that you can look for. And you can also look back in the future whenever you may have issues with wanting to put yourself into a situation that you could possibly potentially be re-exposed to hepatitis C. Look back at that information and say, okay, this is what I had to go through. Do I really want to do that? Perhaps that might be helpful in the future as well. Keep an open mind. Again, the treatment duration has gone from 48 weeks down to 12 weeks in a lot of cases, and even in some cases down to 8. It's one of those things that you can look at. This is a temporary type of a treatment and situation, and it can have lifelong outcomes that are definitely positive, with the cure rate at 90% or better with genotype 1. So keep an open mind. This is the end of the presentation. I hope the information presented was helpful. If you have any questions, please feel free to contact Dr. Bean's office. Thank you.